Good morning, everybody. Welcome. Happy Friday. It's our Q&A Friday. So welcome to our Natural Health News live show. I am Dr. Melissa Gallagher. I'm the host every morning at 9 a.m. We are talking about coronavirus, COVID news, and a whole bunch of information, scientifically focused, grounded, clinical research that can help you and your family stay safe during this first wave, maybe the second wave. It's the big question mark of the day. So welcome to all of you joining. Let me know where you're tuning in from. I have a whole bunch of news today to report. And then I have your questions. I've got Instagram questions. And then I also have a tab where I am looking at questions that came through on YouTube. Those will be answered first, and then I'll dig into your questions. And this is really your opportunity to talk about any type of question you might have. So let's dig into our news of the day. So the world is at 7.5 million cases of coronavirus. The US is at 2,064,000. Our fatalities now are up to 115,000 individuals. And also, I have some news to report about the different states, but I also want to dig into a little bit about what's going on in the world. So Brazil, even though they're not reporting as much detail as many of us had hoped, we are seeing that they are, at least some of the private tests are still able to report. So we do know that we have individuals who are being tested in the hospital setting, and this is how we are getting some of the data. So at least on Brazil's numbers, they are over 800,000 cases. They're at 805,649. From yesterday's report, that has gone up by 30,000 cases. Russia's at 511, almost 512. And India is almost at 300,000 cases. And India is definitely dealing with an outbreak there as well. So China also has reported that they have 7 cases inland, new cases. 6 of them apparently have been notated, imported traveler cases. And so I'm not quite sure the details if they are having folks quarantining, but that definitely is a factor. So the other thing in California, I had highlighted, I think earlier in the week, or maybe it was late last week, maybe it was Saturday, the OC Department of Health director, she resigned because of the whole face mask issue. People were protesting at her home. They were like literally showing up, protesting her requirement to wear face masks. People were freaking out. And there's a whole bunch of research. Look at this, lots of research. This is one journal discussion out of Germany. It's the IZA, Institute of Labor Economics. And then there's another one that was just posted coming out of Texas A&M. Primarily, it's Texas focused, Texas A&M, Texas University of Texas at Austin, Pasadena. We have the University of UCal, San Diego. So I'm going to highlight a little bit more about this that showcases more and more research showcasing the benefits of mask wearing. Friends, this is what we need to be using. And this is a type of mask that my friend Sarah makes. She has these on Etsy. I've got links down below. She gives you an ability to insert a filter like this, 5-layer carbon filter. This is equivalent of an N95 mask. When you are using a thick material, rough material like this, very adjustable around the nose, and it can tie in the back. So this is something we need to be talking about, and we need to have multiple of these available for everybody who is going out and about and re-socializing, re-entering the workspace. So we'll talk a little bit about that today. Texas, I want to highlight Texas. They are now over 80,000. They're at 81,000 cases. They jumped up by over 2,000 cases in one day. They are definitely one of the states on the incline. And Florida had its largest day yesterday. Today, they had over 2,000 cases in a matter of a day. The other thing I've highlighted, and I want to highlight too, some of the racial, socioeconomic inequalities when it comes to healthcare reporting. We are finding that there's an article I read about the Native population is having a challenge with federal and state health organizations restricting the tribe's access to data amongst the tribes. So trying to identify data and information to limit the spread within the tribe. And they're having some reporting challenges with the CDC. Apparently, they've turned down tribal epidemiologist requests for data and information. And because the tribes are their own nation, we're having this kind of discrepancy in reporting, even though they're engaging with other Americans in their population. So that is one thing I wanted to highlight. The other thing I want to highlight is there is reporting specifically out about the PPE shortage. It remains a shortage. Reports in California and Chicago, and those are top 4 states. So New York and New Jersey continue to be the top 2. The third state with the most outbreaks is California right now, 139,000, and they've been growing this week. And Illinois is at 130,000 cases, and both states identified that they have PPE shortages, even gown shortages for the nurses and the healthcare professionals taking care of COVID patients. And what they've articulated is that there is definitely a PPE shortage in and amongst a racial divide, meaning that communities of color have community hospitals that are considered safety nets. And they traditionally have just Medicare cases or provide a certain level of care to folks that are under a certain amount of coverage. And they tend to be less profitable. And because of that, they don't have always the funding for things like PPE. And the American Nursing Association took a poll of nurses, particularly in some of these harder hit communities. And it was over 14,000 nurses participated in the survey. And all these nurses, 79% of them said that they were forced or required to recycle PPE, either reuse it or recycle it for more than a day. Some were reporting a week, several 3 weeks. And then also 59% of those nurses felt unsafe doing that because of the studies that I'm going to highlight more today. More and more studies are showing that the overwhelming population of healthcare providers, if they were properly protected with PPE and not having to recycle, and we had the right equipment, that they would minimize their transmission. And one of the things that's concerning is some of these floors that are non-COVID floors are actually conserving PPE, and they're allocating it to the ICU and ER. What that means is the patients that might be in med surge, or they might be in labor and delivery, they might not be wearing all of the right protective gear. And what they found is that we know a lot of the tests that are being run are actually coming back with false positives or false negatives. So there's an underlying current of fear, and 59% of the nurses, 59 of a fear of being at work and being exposed, especially to an asymptomatic population or communities where they're not protected against. And the big thing that they highlighted was that in Illinois, there's a huge gown shortage on top of mask shortages. So that is something that I wanted to make everybody aware of. And I see comments, Monica, it's horrible. Profit over people is BS. Kingpin Dian, it's all about the money. Let's see. Yeah, I see a lot. Dear California Senate, why have you made it illegal for me to buy nature alcohol? Okay. It's just insane. So at any rate, that is very alarming. We need to listen to our frontliners. We need to observe and honor their concerns, and we need to see some changes within that space. I know also, if we look at the cost that is being charged for some of these tests, a $7,000 COVID-19 test, that money could be allocated elsewhere. And so, it's just a whole cycle of madness. There's also communication yesterday. I read it late last night. Science Magazine is talking about some vaccines specific to COVID, and they're extrapolating or suggesting that there should be an assessment of the oral polio vaccine to see if that might be a potential solution, particularly for children. And as a mother and as a parent who's thinking about what are we going to do next school year, meaning fall, like August, so two months away. What are we going to do when school returns, or if it is going to return, what does that look like? And I don't want to get into a vaccine debate, but it is something that they are encouraging more assessment of vaccinating children and opening up the vaccine trial to existing vaccines. And so I just want to put that out there. That was some news specific. The oral polio vaccine, it's actually not available here in the US anymore. Brian's parents were over last weekend, socially distanced, of course, but they were over for a quick visit. And his dad was telling us, and I remember thinking, like, I've never heard of a story like this, but he was telling us, like, when he was younger, he grew up in Virginia. When they were younger, like one summer, there was like a nurse who came to the local pool, and they had these little sugar cubes, and they had this like little kind of squirter that they'd put the vaccine on a little sugar cube. And all the kids were excited because they were taking these straight sugar cubes with a vaccine on it. That's the oral polio vaccine. And that's what he was referencing. And I don't know what's going to happen with that, but I think, the fact that Science Magazine is digging in, it definitely will probably yield some scientific research. Also, for all of us parents, this is really sad news. With COVID-19, the closing of a lot of businesses, with staying at home, and also them being communities or catering to populations of dense communities or dense consumer bases in their business model, it poses a challenge, especially with children as well. So I want to highlight Chuck E. Cheese has filed for bankruptcy. That is like, I grew up on Chuck E. Cheese. Gabriel's really loving it. All of his friends have had Chuck E. Cheese birthday parties. He wants one there at some point in the next year or two. And so we might be seeing this virus shut down Chuck E. Cheese permanently. And also the American Cancer Society is announced they're laying off 1,000 employees for outreach and education. And that will have a long-term effect in terms of population awareness, education, screenings for cancer, as well as research. So we're definitely seeing the expansion of this virus in and amongst our communities. We're still seeing increases in states, Arkansas, Arizona, Texas, Florida, are on the incline, California as well. Still, I think we're now at 21 states that have had an increase. And I reported yesterday, 3 days in a row, from June 6th to June 9th, there was a 36.5% increase in cases in the US. We're still in a pandemic, even though we're kind of blinded by it right now. Or we have blinders on. So let's talk about, before we can dig into your questions, let's talk about this. So this is an extensive research study done in Germany, and it's titled "Face Masks Considerably Reduce COVID-19 Cases in Germany, a Synthetic Control Method Approach." And the German community, there are 4 or 5 authors of this study. They look at regional variations. They look at mask wearing over a period of 10 days. And they concluded that face masks reduce the daily growth rate of reported infections by 40%.